Have you ever wondered about the role of legislation in sickle cell care? If so, you're not alone. It's a topic that's gaining attention in the realms of healthcare policy and advocacy. Legislation, you see, has a profound impact on the landscape of sickle cell care. Welcome to the Victory Education Lounge. I'm your host, Maurice, and today we're diving into part 44 of our series, Policy Matters, Legislation, and Sickle Cell Care. Before we begin, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us reach more people with this crucial information and drive policy change. Legislation plays a vital role in shaping the landscape of sickle cell care. Today, we'll explore how policies impact the lives of those with sickle cell disease and discuss strategies for advocating for beneficial legislation. Legislation is the tool that can shape the experiences of those living with this condition, for better or worse. In our discussion today, we'll be focusing on 5 key areas where policy can make a tangible difference. These areas include research funding, healthcare access, newborn screening, education and awareness, and workplace protections. Each of these elements have their own unique sets of challenges and opportunities when it comes to policy making. Understanding these areas is the first step towards advocating for beneficial legislation. So, are you ready to dive in? Now let's delve deeper into each of these key areas and see how they can shape the world of sickle cell care. First on our list is research funding. This is the lifeblood of innovation, the fuel that drives the engine of discovery in our quest to better understand and treat sickle cell disease. But why does it matter? Well, increased government funding for sickle cell research allows scientists and medical experts to push the boundaries of our current knowledge, explore new treatment methods, and unravel the mysteries of this complex disease. It's the financial power that turns the cogs of the research machine, enabling the development of improved diagnostic tools, more effective treatments, and hopefully, one day, a cure. However, every coin has 2 sides, and research funding is no exception. While it holds the potential for groundbreaking advancements, it also competes with other equally important funding priorities. Every dollar allocated to sickle cell research is a dollar less for another critical area of health or social concern. Plus, the fruits of research often take time to ripen, with significant results sometimes years or even decades down the line. Despite these challenges, the impact of increased research funding on sickle cell care is undeniable. For instance, the Sickle Cell Treatment Act of 2003 in the US significantly boosted funding for research and treatment centers, leading to improved care for thousands of patients. Similarly, in the UK, increased funding allowed for the development and subsequent NHS approval of the revolutionary drug advocacy in 2019, which has significantly reduced pain crises for many sickle cell patients. As we can see, research funding is a crucial aspect of improving sickle cell care. It's a tangible demonstration of a society's commitment to advancing healthcare and improving the lives of those affected by this disease. So, whether it's advocating for increased allocation in government health budgets, supporting grants for promising studies, or pushing for diversity in research participation, remember that every effort counts in the fight against sickle cell disease. Next, we turn our attention to healthcare access. The hallmark of a compassionate society is how it cares for its most vulnerable members, and this includes those living with sickle cell disease. Ensuring affordable, comprehensive care for these patients is not just a moral imperative, but a practical one too. So what does healthcare access look like for someone with sickle cell disease? It means regular checkups with healthcare professionals who understand the complexities of the condition. It means affordable medications that manage pain and prevent complications. It means access to mental health services to cope with the psychological toll of living with a chronic illness. And it means emergency care that doesn't leave patients bankrupt. But like all good things, there are challenges. Implementing such comprehensive care can be costly. And let's not forget the political resistance. In a world of limited resources, there are always competing priorities. However, the cost of not providing adequate care can be much higher, both in terms of human suffering and long-term healthcare expenditure. Let's look at some examples of how policy can improve healthcare access for sickle cell patients. In the United States, the Affordable Care Act has expanded access to health insurance for millions, including those with sickle cell disease. This has meant more regular checkups, better disease management, and fewer emergency hospital visits. In Ghana, a country with one of the highest rates of sickle cell disease in the world, the government has made sickle cell treatment free at the point of delivery. This policy has led to a significant increase in the number of people accessing care, with a corresponding decrease in mortality rates. In India, the National Health Mission has established dedicated sickle cell clinics in high-prevalence areas, providing comprehensive care to those who need it most. Each of these examples underscores the power of policy in improving healthcare access. But there's still much work to be done. In many parts of the world, people with sickle cell disease continue to face barriers to accessing the care they need. Clearly, access to healthcare is a vital part of managing sickle cell disease. Now let's talk about newborn screening and education. Imagine a world where every newborn is screened for sickle cell disease. Then, imagine a world where every student, every teacher, every healthcare worker knows about sickle cell disease. Sounds like a better place, right? That's the power of policy. Mandatory newborn screening can facilitate early intervention. It's like having a heads up on a storm before it hits. When we know a child has sickle cell disease from the get-go, we can begin treatment and care early. This can significantly improve the child's quality of life and even extend their life expectancy. But it's not all sunshine and rainbows. Implementing universal screening requires substantial funding and robust infrastructure. It also brings up questions about privacy and consent. Then there's education. When we educate the public about sickle cell disease, we reduce stigma and increase understanding. Imagine if every school curriculum included lessons on sickle cell. Imagine if every healthcare worker was trained to recognize and treat sickle cell crises. That's the kind of world we could create with the right policies. But again, there are hurdles. Education about sickle cell competes with other educational priorities, and changing curriculums or healthcare training can be a slow process. Despite these challenges, we've seen the impact these policies can have. In Brazil, a universal newborn screening policy implemented in 2001 has led to early diagnosis and treatment for thousands of infants. And in France, a 2019 national plan for rare diseases included specific measures for sickle cell awareness, improving understanding among healthcare providers. As we have seen, early detection and education can make a significant difference in the lives of those with sickle cell disease. But these changes don't happen overnight. They require committed advocates, willing policymakers, and a society ready to embrace change. So let's keep pushing. Because every child deserves a chance at a healthy life, and every person deserves to live in a world that understands their struggles. Finally, let's examine workplace protections. Living with sickle cell disease doesn't only affect a person's health, it also has significant implications for their employment. In many instances, those with sickle cell disease may require special accommodations to manage their condition effectively while maintaining their productivity. This is where the importance of workplace protections comes into play. These are laws and policies designed to protect individuals with sickle cell disease from employment discrimination. They ensure that employees with sickle cell disease are treated fairly and are provided with the necessary accommodations to perform their jobs. These may include flexible working hours, additional rest periods, or the ability to work remotely when needed. The benefits of these protections are significant. They not only ensure fair treatment in the workplace, but also support the financial stability of those with sickle cell disease. However, it's not all roses. Implementing these protections can face resistance from some employers who may view them as burdensome or costly. Additionally, enforcing these laws can sometimes be a challenging task, often requiring advocacy and legal battles. The Americans with Disabilities Act in the United States is a shining example of how workplace protections can make a difference. This legislation has provided crucial protections for individuals with sickle cell disease, helping them maintain their employment while managing their condition. It has helped create a more inclusive and supportive work environment, promoting equal opportunities for all employees regardless of their health condition. In the United Kingdom, the Equality Act also offers similar protections, making it illegal to discriminate against employees due to their health condition, including sickle cell disease. This has empowered many individuals to continue working and contributing to society despite their health challenges. Progress has been made, but there is still a long way to go. Advocacy and policy change are needed to ensure that these protections are not only enacted, but also properly enforced. Workplace protections, as we have seen, are a key aspect of ensuring fairness and stability for those with sickle cell disease. So, what have we learned today? We've journeyed through the critical areas of policy that directly impact those living with sickle cell disease. from advocating for increased research funding and accessible healthcare, to supporting mandatory newborn screening and education, and finally, pushing for workplace protections. Each of these areas is a critical piece of the puzzle in improving the lives of those with sickle cell disease. We've also seen real-life examples of how policy changes have substantively improved patient care and outcomes from the United States to the United Kingdom, Brazil, and France. But remember, these victories didn't happen overnight. They were the result of persistent advocacy and a steadfast commitment to change. As we've seen, policy isn't just about laws and regulations. It's about the lives of real people. Remember, legislation plays a crucial role in shaping the landscape of sickle cell care. Your voice can make a difference in advocating for beneficial policy changes. Before we conclude, I want to emphasize that the information provided in this video is for educational and entertainment purposes only. Any health-related decisions should be discussed with a licensed physician or qualified healthcare professional, especially if you have existing health conditions or are taking medications. While policies can greatly impact care, they should complement, not replace, professional medical guidance. Thank you for joining us today at the Victory Education Lounge. If you found this information helpful, please like, share, and subscribe to our channel. Your support helps us continue providing valuable content and advocating for policy changes that benefit the sickle cell community. Remember, your voice matters in shaping the policies that affect sickle cell care. Until next time, stay informed, advocate for change, and stay victorious.